Welcome to the Debate at Go8 podcast series. Today we'll be looking into the area of One Health, that connection between human, animal and environmental health. And we'll be doing it with a world leader in this area of research, Dr. Anne-Lise Chaber, who's taken up a joint appointment at the School of Public Health and the School of Animal and Veterinary Sciences at the University of Adelaide. She was the brains behind the COVID dogs deployed at Adelaide Airport and hospital emergency departments to detect those infected with the virus during the worst days of the pandemic. But her groundbreaking work has far broader implications for disease detection and some of the biggest challenges we face globally. Hello, my name's Ron Candelars. I'm a freelance journalist and producer, and throughout this series we've been canvassing a range of topics touching upon the work of all the Group of 8 universities. They include the Australian National University, Monash University, UNSW Sydney, the Universities of Adelaide, Melbourne, Sydney, Queensland and Western Australia. Also in the studio with me is Vicky Thompson, the CEO of the Group of 8 universities. So firstly, Dr. Anne-Lise Chaber, your field of research is fascinating, One Health, this connection between human, animal and environmental health. Why is it so important? What's it really all about?
Well, it's a new term, but it's a very old concept. It's the fact that we are all connected. And speaking about disease, animal disease can actually affect human and vice versa. Or if we look at the environment, if we destroy the environment, it will have repercussion on human and animal health. So it's the fact that all health, human, animal and environment, are interconnected.
Can you give me an example of where that destruction of the environment impacts on us?
Nipah virus that happened in Malaysia in 1999 was directly linked to the fact that piggeries started to encroach in the forest where bats were. So we started to have a direct contact between bats and pigs, which actually led to the emergence of a new virus, Nipah virus. And this virus went from bat to pig, pig to human. And that was the first chain of transmission. A bit later, same virus, but different kind of transmission. We had direct contact between bats and human in Bangladesh because humans were collecting sap around palm trees and the bats were actually licking the same liquid. And that's how the contamination happened. And then we had a human-to-human transmission. So that's a typical example of a human encroaching in a natural habitat and having a disease that is occurring.
And this transference of virus is called zoonosis, is that right?
It's called zoonosis, yeah. So a lot of people are speaking about zoonosis, and it's true that 75% of emerging infectious diseases in humans are linked to animal. So it's either a true zoonosis, meaning that you get disease from the animal, or it's a disease of animal origin. A huge pandemic is a pandemic of HIV. 26 million of people died since 1980. 40 million of people are orphans due to HIV. Where did HIV come from? HIV, actually there is two HIV, HIV-1 and HIV-2. Both of them are coming from primates. And so HIV is human immunodeficiency virus. It's actually coming from SIV, simian immunodeficiency virus. It was this link between human and primate, linked to very likely bushmeat. So some people
what?
Bushmeat. Okay. So when you go in the forest and kill an animal for human consumption, that's bushmeat.
Yep.
And according to epidemiological investigation, it seems that it actually occurred in 1920. That we had a link between a human and an animal where SIV has been actually transmitted. And the human got contaminated. Now it's very interesting because that must have happened for 100 years. Why in 1920 did SIV become HIV? Because there is always socio-ecological factors that are actually promoting the emergence of the disease. So it's not only the source, like the fact that the disease is coming from the animal to the human, but what in the human population is happening to allow this disease to actually, or this virus, to transmit between human and to actually adapt to the human organism. And for HIV, if I want to continue on this example, it was right during colonization. A lot of people were displaced, were put in working camp, only male. there was a booming of prostitution around this working camp. That's one route of transmission. And the other route was large campaign to treat people for African sleeping sickness and syphilis and so on. And the injection material that they were using was not always cleaned properly. And so we had two ways of transmission of this virus. And that's the reason why a large population got infected, mainly in Kinshasa and Brazzaville, which was a big hotspot of HIV.
So are these zoonoses becoming more prevalent as we destroy more of their environment and bring humans closer to some of these wild animals in their environments?
Yes. One big aspect of my research is actually on illegal wildlife trade. And the reason why I'm very interested in illegal wildlife trade, I'm trying to actually work with law enforcement agencies to tackle that issue, is that obviously it's a threat to biodiversity, but it's also a threat to public health. And when we've got someone going to a forest or a cave to kill or collect animals, the animal can actually be collected dead or alive. It's a very close contact between human and animal. And the animals are very stressed. So they're shedding a lot of bacteria and viruses. So this is really promoting the emergence of diseases.
And how widespread is that? Is it more widespread than we would think?
I think it's very widespread, but to actually, very good question. It's very widespread, but to actually be able to report it, we need to have human cases. So I feel that I'm still pretty young, but in my very short career, I've seen the emergence of SARS-CoV-1. So I don't know if you remember that happened in Hong Kong, and that was linked to civet and the trade of civet in this area of the world. Then I've worked directly on MERS coronavirus. So that's another virus that went from bat to camel, and people were actually being infected via camels. MERS coronavirus infected 2,500 people, 800 people died. I was working in the epicenter in the UAE, and it was actually killing 1 person out of 3. Wow. The difference with SARS-CoV-2 and MERS is that MERS was not very transmissible between people, while SARS-CoV-2, as we know, had very different mortality rates, much lower than MERS, but very transmissible between people.
Can I just ask, how did you get into this? So was it the environmental side? I know that you're a veterinary scientist originally. So how did you diverge into that? It just seems quite a leap.
Yes and no. So I did veterinary studies because I wanted to protect wildlife. I wanted to save endangered species. I specialized in wild animal health. When I was working in Africa and then 8 years in the Middle East, I was really working in trying to control large outbreak in endangered population. So that gave me a suite of technical skills that can be applied to any species, including human. And I was always trying to find, what is a pathogen that is actually affecting those animals? Where does it come from? How is it being transmitted? And can we vaccinate those animals? This is pretty standard and that we do for any pandemic. But the other risk that is linked to, that is actually threatening those large population of animals is not only outbreak, is also illegal wildlife trade. And illegal wildlife trade has huge consequences on public health. And so I was always trying to bring this aspect and this card to the table and saying it's not only a threat to those population, it's actually a threat to all of us. And that's the reason why I'm working in this space.
What brought you to Adelaide University and Australia?
Yeah, that's because you actually offered, or they offered, not you.
I personally offered you.
No, they offered a One Health position. And I have to say that at that stage, like a bit more than 5 years ago, there was no One Health position in Europe. There are a few in the US and in Canada.
So here in South Australia, they got it. They understood.
They got it. That was the first One Health position that was actually advertised as a One Health position. And that's the reason why I came. So I spent 8 years in the Middle East doing a lot of field activities. I did a PhD in field epidemiology for One Health. And then I was very attracted by academic freedom. And this One Health position was just a perfect opportunity.
It's interesting you mentioned this One Health thing. And when I read through your backstory, I love the analogy where you talk about the ecosystem is like a living body where each population, like organs, interact with each other, and the disruption of this balance makes the entire system dysfunctional. So, One Health is about acknowledging that all of these things feed in. And it seems to me that, humanity has turned a blind eye to that for such a long time with all the problems of climate change, destruction of the Amazon, all that sort of stuff. What you're saying is that thankfully in a place like South Australia and Adelaide University, they're beginning to recognise this stuff.
Yes, they're beginning to recognise it. I think the term One Health has been actually coined in 2012, so it's quite late. Having said that, if you look at the old medical text from 2,000 years ago, they already mention One Health. And the indigenous people do understand this connection between the environment and our health. The fact that it's actually very late in the academic curriculum is a bit of a shame, but yeah, it's true that Australia was one of the first to actually put it out there. And now we also are getting in Australia a CDC that is going to include One Health. So it's not only academia, but also the government is
research
embracing.
Areas, yeah.
Yes,
yeah.
And that is a direct result of COVID, isn't it? That's the CDC model.
Yes.
Because I guess we were left wanting a bit when we suddenly had the pandemic and we didn't have that centralised communicable diseases group.
Yeah.
So
exactly, and this transsectoral approach of not only looking at human diseases, but really understanding the different drivers for those diseases.
And maybe a naive question, but you've worked all over the world in incredible places, and you talk about the illegal wildlife trade and other things. Is there a particular Australian lens to the work you're doing? So this is going to sound so unscientific, but for example, kangaroos, wombats, koalas, I'm just wondering, is there any evidence of any diseases passing from them to us? And is there an Australian aspect to this, or is it just that you are a global researcher who got an opportunity in Australia? Because we do have unusual animals.
You do have unusual animals. We don't have
but not unusual diseases.
We don't have many diseases here going from animal to human. We do have some. So one, for instance, is Chlamydia psittaci.
Yes.
That is from in our parrot population or bird population, and that people can get and can be very serious. We also got Q fever. Well, everywhere in the world except Arctica and Antarctica and New Zealand have Q fever in the animal population, and thus it's a threat to human population. But other than that, we don't have big diseases that we are to be very worried. Oh, I should still mention Hendra virus. So it's like Nipah virus, but it's actually affected horses and thus humans. In Australia, regarding the wildlife trade, we don't have many things coming in. To be fair, we've got a very competent Department of Environment and Water and Border Force that are really controlling our border, and it's kind of easier. We are an island at the end of the day. But we do have animals coming out, especially reptiles that are endemic to Australia. We've got a very high value in the international market. So we've got a trade of reptiles.
So do they pose a risk?
They don't pose a risk, but they are being exported to other countries.
Right. Obviously, zoonosis really came to the fore when, Australians and the world got their head around COVID, coming from bats and, well, laboratories, who knows? But, we try to work out, we're aware, though, of this transmission from animals to the broader population. And it's in the area of COVID that I wanted to speak to you, particularly the work that you've done with man's best friend, the dog that can really sniff this out. That was remarkable, and you got some national coverage based on the work that you've done there. Speak to that.
Yeah, so at the very beginning of the pandemic, I was thinking, what can I do to have a positive impact? I used to normally be in this kind of situation where I'm just right at the spot where I actually can carry in epidemiological investigation in the field. But we were in Australia, no COVID cases, but it was coming. And I remember my time when I was in the UAE during the MERS outbreak in the UAE. And the most important thing is to actually manage to screen people quickly.
Yeah.
Fast and reliable screening tests to be able to actually separate the positive from the negative people, especially if we've got positive people that are asymptomatic. And I knew from my experience with animal or with human that PCR is a reliable test, but is never fast enough. And I was also realizing that PCR rely on laboratories that can do the PCR. And if everyone has to do PCR, we will be overwhelmed.
Yeah.
So that's one thing. I also knew that rapid antigenic tests, so all the antigenic tests, are much faster, but they never get the sensitivity, the reliability that we do with PCR. So I was really scratching my head on how can I have a positive impact and do research that is going to help Australia when we start to have COVID. And I was not a specialist in volatile organic compound, but through doing a lot of review, I was like, okay, this is something interesting. There was this hypothesis that disease have a scent and that we could either develop electronic nose to detect those diseases or dogs. And at this
Does
stage,
it have a scent because of sweat?
it has a scent because when the cells are being attacked by the virus, and there is this viral replication, it's actually releasing metabolites, including viral amino acid, that can be detected by a dog. And that doesn't mean that all diseases have a scent, but we've tried COVID. And I have to say that I was very much helped at this very initial stage by a professor who is working in France. And I asked him, does it work? Do you have like preliminary finding that are suggestive that dog can make a difference between the sweat sample of people that are infected by COVID and sweat people that are not infected by COVID? And he told me, I cannot tell you how sensitive dogs are, but I can tell you that we've tried with one dog and it did make a difference. So I was like, okay, that's good enough to actually have a go. At that time, it was an idea that I don't know if people were really believing it, but I was very lucky because I contacted our DVCR, Anton Middleberg, and he gave me the first bit of money that was just enough to actually start the project. And then I contacted the Australian Border Force and I say, well, would you be inclined to be part of this project? And they were a massive player in this project.
In many ways, it just shows you that in a crisis, amazing things can happen.
Yeah.
It's not that we wish a crisis upon us.
No, but it forces people to think.
But it forces you to think a bit
laterally
outside the square.
Yeah.
And in a normal, and you will correct me if I'm wrong, but in a normal context, one professor and one dog in France would maybe not be enough to start a process, and then there would be a time frame and he'd be a couple of years down the track. And I'm very pleased you mentioned Anton because he'll be very happy. He's the Deputy Vice-Chancellor at Adelaide University. But just putting a bit of seed funding in and saying, let's give it a go, may not have happened in a non-COVID environment. We were all scratching our heads and trying to do that. So it's a great example of where I think university research and researchers can actually be quite nimble in their thinking, obviously, and move very quickly. And look where we've got to.
Is there any one particular breed? I mean, I've got a little Tenterfield, a gorgeous little Tenterfield, but I dare say it seems to be Labradors.
So we used Labradors because all dogs were provided by the Australian Border Force and they are using Labradors. So that's the reason why they were part of this program. We believe that other breed could do it. The only thing that is important is that the dog has a drive to work.
Right.
I'm just going to bounce back.
Oh, that counts out text then, mine.
I just want to bounce back. I think Australia has got a very good track record on being actually quite on reacting quickly and allowing research to happen. I know that this dog projects actually occurred in 30 countries. But I believe that now we are kind of ahead of the game and doing that with COVID, but with also other diseases. We've developed a training aid, so it's actually a surrogate scent of COVID to train more dogs and so on. And because not only the research environment was supportive, but governments were happy to actually think out of the box and try to support researchers. So we've got, I think, a good environment to respond to crisis, while other countries it might not have been that successful because there were delays.
It's a bit slower.
Yeah, exactly.
Do you think these dogs could be used to detect other viruses?
Yes, so I cannot speak much now about it, but we are trying.
Is something happening?
Is something happening? Yes, we are trying the dogs on other diseases, and the results are very promising. So yes, we believe that they can be used for many more diseases, and maybe could be part of the next as a tool to actually.
It's game changing, really, isn't it?
It is game
it's
changing,
revolutionary. Yeah. And there's even been talk about dogs being able to potentially detect cancer. Is that right?
Yeah. So that actually came before COVID. We know the first report was in the late 90s that a dog kept poking a lesion on the back of his owner. So this dog hasn't been trained to actually detect melanoma, but kept poking this lesion. And so this owner went to his doctor and said, I don't know, my dog is scenting or smelling something on my back and is scratching a bit. What is it? And it was melanoma. And the person got treated on time. So it was clear that the dog could actually detect something. And then we've got another case that's been actually reported in the literature in 2013 where someone had, again, melanoma behind the ear, and it was a dog telling this person. And since then, much more research has been done. And we know that dog can be used for ovarian cancer, prostate cancer, skin cancer. So this is something that was already happening in the background. The novelty with COVID is that no one was really trying to use dog for infectious disease.
Yeah.
And that's what we brought to the table.
So should we be investing a lot more money in this research? And if so, what are the barriers to that? You'd know better than any, and I dare say you'd be saying, yes, we should, because you're a researcher. But it seems to me it's a no-brainer. We've got these little characters sitting at our feet, and they're these amazing tools to use.
So I think dog can be a very good tool to actually screen a lot of people in a very short period of time.
Yeah.
So for instance, in an airport environment, and we deploy dog in the airport and we deploy dog at the hospital. So we're working very well in both settings. But I think where we can really make a difference is when we've got a lot of people to screen, 300, 500 in like less than an hour. And then the dog is not going to be the only screening tool, but could be a very good screening tool to do a triage.
Yeah.
And that will save us time and money, and also make sure that the hospital system is not overwhelmed.
Yeah.
I can just see going into, Flinders Medical Centre, and instead of going to the triage nurse, we go to the dog sniffs us, you go that way or that way. I mean, where could you see it going in all seriousness in terms of productivity and health, which is always an issue?
We've certainly got used to them in airports, sniffing for drugs. I mean, why wouldn't we use them? Yeah.
Drugs.
Yeah.
So I can speak about both our experience. In the airports, it was, at that time, we were only using sweat samples. So we were asking people who were coming off the plane, give us a bit of your sweat. And we were giving that to the dog a bit further so people couldn't see the result, because we didn't want anyone to be feeling uncomfortable because a dog is sitting in front of you and you've got everyone watching and knowing that you're positive for COVID. That was good, but it was a very slow process because we have to actually get the sample, bring it to the dog, and then get the result. In a pandemic situation, if we had another COVID, hopefully we don't, but if we do, we could have the dog working in the airport and maybe asking people to come in a little boot, and then the dog can sniff there. And that's what we've done at the Lyle Microen Hospital. The dog were working in the emergency department. People were coming in. They were being sniffed by the dog. The dog was giving a response. We were recording this response. And then people were still going for their rat test. So it was not changing anything on the triage that was being done down the track. But we had the answer of the dogs first. And that was very, very good. The only issue is that our dog need to screen a lot of people in a very short period of time. Otherwise, they get a bit bored. It's not a machine. And that's the disadvantage of working with a dog, is that they can get bored or they can get tired. So I think we should invest much more money into this detection of volatile organic compound, either by using dog. I think dog is a very good first tool to know if something is detectable, but then really work on electronic nose, because this will actually be a machine that can be used.
Is there a role for AI in that?
Yes, so it's interesting. The United States have trained ferrets to detect AI, and they can. So we could potentially train dogs. We just have to make sure that we train a species that is not sensitive to the disease that we want them to find. So for instance, for COVID, dog have a very low sensitivity for COVID, and we were never putting them in a space where they were going to be at risk. So even in the hospital, people that were being screened had to have their mask on and so on. And we were screening our dogs, PCR screening our dogs every 3 weeks, during the entire period of the study, and none of our dogs ever became positive. But so, yeah, we can do that for many diseases, I think, but we just have to always be very conscious of, can it actually be
passed back
to the dog?
Yeah.
Exactly.
Where does Adelaide University sit in all this when it comes to this research? Because you've got this appointment at the School of Public Health and the School of Veterinary Sciences at Adelaide Uni. By the sounds of it, they're fairly prominent in this space. Would you say that they're kind of leaders in this field?
I don't like the word leader because I think we are leader because of the help of others.
Yes.
But yes, we are the one now driving the train.
Oh, great.
In this particular space of medical detector dogs who can actually detect infectious diseases, not for the cancer or not for. There is also medical detector dogs that are being used for Parkinson and so on. We are not doing that at all. So the reason why I'm really interested in infectious diseases because I like to look at disease that can have an impact on global health.
Mm-hmm.
So to me, there is this part of this project that is like, okay, if we do have another disease, we need to have the right tool to screen lots of people very quickly. And then I think 80% of my research or 50% of my research is geared toward prevention. How do we make sure that we don't have another disease? And that's really is linked to the illegal wildlife trade.
But it really shows the impact of Go8 University's research programs having a direct impact on the broader population.
Yes. I think we can reiterate that the world is a village and the researchers are just a little house in this village. And we are all connected. And at least on my side, I feel that the research I'm doing is actually worldwide research, but I'm doing it from Adelaide and has a positive impact on everyone.
Well, Dr. Anne-Lise Chaber, it's been fantastic talking to you. Yeah, there's many more stories to pursue, but great work in this area of One Health. Thank you for your time.
Thank you for having me.
Thank you.
Thanks for your company today. If you'd like more information about the issues raised in this podcast or other related topics, please visit our website at go8.edu.au. And a quick reminder that you can always tune into the debate at Go8 on Spotify, Google, Apple or YouTube. Bye for now.